Hello everyone, my name is Sang-Hoon Lee, Managing Director of KAIA, Korea Agency for Infrastructure Advancement. This course is mainly about COVID-19 contact tracing system. We call it CTS for convenience. The CTS is an epistemological investigation system for tracking confirmed patients' movement routes. This course focuses on introducing COVID-19 contact tracing system of Korea. She was developed through the Smart City Data Hub platform, the achievement of the National Smart City R&D program. The course provides a short background of the development, main concept of Smart City, operating structure of the system. Participants of this course will understand main framework of the Smart City and some implications of Korea's COVID-19 response related with CTS. The COVID-19 CTS conducts an epistemological investigation, which is essential activities need to be done to prevent the spread of infectious diseases like COVID-19, according to the Act of the Prevention of Infectious Diseases in Korea. The system enabled the automation of the investigation process through real-time analysis of confirmed patients' location information and credit card transaction history. And as a result, the system shortens the investigation time from 24 hours to less than 10 minutes. This system is also called COVID-19 Smart Management System in Korea. Before beginning the lecture, let's watch the introduction video of the system.
코로나19 역학조사를 위해서는 확진자의 이동 동선 분석과 발병지역 분석이 필수적입니다. 이번에 스마트시티 기술을 기반으로 개발한 역학조사 지원 시스템은 역학조사에 신속하고 정확하게 많은 도움이 되고 있습니다.
The system is developed from National Smart City R&D program, which is managed by KAIA. As many patients of COVID-19 confirmed in Daegu, which is also the test bed of this Smart City R&D program, the work burden of epistemological investigators were exploded, and the necessity of early use of the Smart City Data Hub that can quickly and accurately analyze huge amount of data was raised. In response, we discussed on the use of the Data Hub on February 24th with the researchers and the government, demoed it, and began to develop the system. The development of the system was finished on March 16th, and after the pilot operation for 10 days, the system officially started to be operated on March 26th by Korea Centers for Disease Control and Prevention, KCDC. When we going back to the first, the amendment of the Act on the Prevention of Infectious Disease after March in 2015 was enabled the use of the information from confirmed cases. KAIA is managing National Smart City R&D program, and its main target is to develop standardized open data hub architecture, which will be the common basis to apply transparent and shared administrative services and facilitate digital economy. The program is planned for 2018 to 2022, and its total budget is about $120 million. It is supported by the Ministry of Science and ICT and managed by the Ministry of Land, Infrastructure and Transport. Also, more than 120 researching organizations are participating in this program. This program includes the creation of a smart city in terms of testbed in Daegu and Siheung. As mentioned before, in late February, COVID-19 confirmed patients of Daegu were sharply increased due to crowded religious gatherings. The National Smart City R&D program has been conceptually designed based upon a three-layered framework of smart cities structured with physical infrastructure, cyber system like a data hub, and social service layer. Data integration and interoperability will be critical to make this framework work interactively between physical structure and cyber system to come up with social services and solutions for the benefit of cities. Data Hub will play a leading role in implementing a data-driven smart city model, connecting data from various fields of city domains to be analyzed and processed for efficient city management and social services, and finally contributing to solve various urban problems and provide companies with business opportunities. Data Hub, the core smart city technology, can store, manage, and analyze the variety of different data sets coming from each silo, such as mobility, energy, environment, living service, etc. You can supply the multiple solutions as open API by using stored and analyzed data sets. The architecture model of Data Hub has been developed through the National R&D program, which will be standardized globally. We have collaborated with EU 5 platforms since 2019. The prototype of this architecture will be customized for Daegu and Siheung in 2021. This is the operating structure of the system. When a confirmed case is occurred, investigators of key CDC or local government request related data to the system. The system requests the approval for the data use to the National Police Agency and the Credit Finance Association. After the approval by a police agency and a Credit Finance Association, the request is notified to 3 mobile carriers and 22 credit card companies. And the companies send primitive details to epistemological investigators of KCDC or local governments through the system. Whole this process, such as request, approval, data providing, analysis, and verification, is operated by the system. And the core of the system is Smart City Data Hub, which can collect, process, and analyze a huge amount of data. Investigation process is performed by the officers, those who verify, edit, and finalize details based on the interview with patients. Then epistemological network analysis is conducted. After analysis, the system manages epistemological investigation, and epistemological investigator verifies again the result of analysis based on the interview. Whole this process, such as request, approval, data providing, analysis, and verification, is operated by the system. The core of the system is Smart City Data Hub, which can collect, process, and analyze a huge amount of data. There are lots of paperwork to get approval and data from various agencies and companies, the number of which is 28 in total. The system makes this process automatic and shortens investigation time dramatically. One important point is that not all officials here can access, but only authorized epistemological investigators by KCDC have the right of access for the purpose of personal information protection. The advantages of the system is the accuracy, the agility, and the efficiency. In terms of efficiency, investigation time shortened from more than 24 hours to less than 10 minutes. Actually, it takes about 2 to 3 minutes to analyze it by the system. Also, lots of paperwork with respect to 28 organizations and companies is changed to computerize the records. Due to this efficient real-time system, Korea was able to counteract the mass expansion of the confirmed patient. The Korea Smart City technology is proved its usefulness during this epidemic situation. It is important to continue investing in ICT and to create an ICT ecosystem such as the government's policy and business promotion, financial and market foundation, and private investment expansion. Based on this ICT infrastructure, various applications such as CTS could be actively developed. The CTS supported numerous related agencies to work and fight together. Also, there was a national consciousness and a social consensus across the country that was formed from the experience of MERS in 2015. Through the MERS outbreak, we shared the necessity of cooperation among administrative officials, medical staff, and private sector for responding to infectious diseases. As the crisis alert for COVID-19 became serious, the government's for collaboration between governmental departments and medical institutions was activated. With this public awareness, the regulatory base was helpful, such as use of personal information to prevent the infection. Experiences from MERS, Korea revised the Infectious Disease Prevention Act in 2016 and the provision of regulatory bases such as the establishment and the designation of specialized hospitals, and the mobilization of medical staff, and the use and protection of personal information was established. Especially, Korea is extremely cautious to use personal information to quarantine purposes and try to protect it through this legal foundation. Thank you for listening.